In many households, basic medical knowledge is often assumed to be available through doctors, clinics, or emergency services. Modern healthcare systems are structured around accessibility to professionals, pharmaceuticals, and hospital infrastructure. However, situations occasionally arise where immediate medical assistance is not available. Power outages, natural disasters, remote locations, or disruptions in supply chains can temporarily limit access to conventional care. In these moments, individuals sometimes rely on basic first aid knowledge, printed reference materials, or previously learned procedures to manage common health situations until professional help becomes available. Printed medical guides for non-professionals have existed for decades. These materials typically aim to translate clinical knowledge into structured instructions that can be understood by readers without formal medical training. Within this category of household medical reference books is a publication called The Home Doctor, Practical Medicine for Every Household. This guide presents itself as a large reference manual designed for home consultation in situations where professional medical services may be limited or delayed. The Home Doctor is a medical reference book with approximately 304 pages of written material. It is presented as a structured guide intended for household use and general readers rather than trained medical professionals. The content is organized into chapters covering a range of health-related topics. These topics include common injuries, basic medical assessments, and descriptions of symptoms associated with various conditions. Many sections focus on practical recognition of symptoms. For example, the book outlines indicators that may signal medical events such as heart attacks or strokes. Other sections discuss how to evaluate physical symptoms such as abdominal pain, skin injuries, or irregular heart rhythms. The guide also includes instructions related to common first aid procedures and home care practices. Some chapters describe how to manage wounds, minor infections, or skin conditions using basic supplies that may be available in a household environment. In addition to textual explanations, the book reportedly includes diagrams and illustrations intended to clarify certain procedures or anatomical references. The authorship is attributed to several contributors, including a surgeon with experience in hospital settings and medical practice environments. Unlike structured online courses or scheduled training programs, The Home Doctor functions primarily as a reference manual. Readers typically interact with the material by consulting specific sections when a particular topic becomes relevant. For example, a reader may open the guide to review information about identifying symptoms associated with chest discomfort, or to read instructions related to cleaning and managing minor wounds. The book does not appear to require sequential reading from beginning to end. Instead, chapters are structured so they can be accessed independently. Some sections focus on informational explanations, such as describing possible symptoms associated with certain health conditions. Other sections contain procedural content. These may include step-by-step descriptions intended to guide readers through simple health-related actions performed at home. Because the guide is printed or delivered as a static digital document, it does not include interactive components. There are no quizzes, videos, or digital modules. The experience is similar to consulting a traditional medical handbook, where the reader references information as needed. Household medical guides tend to appeal to readers interested in preparedness and self-reliance. This includes individuals who prefer to maintain a library of printed reference materials covering topics such as first aid, emergency preparedness, or basic health knowledge. Some readers may keep guides like this as part of emergency planning resources, alongside other materials related to disaster preparedness or remote living. Others may use the book simply as a general educational resource to better understand how certain symptoms appear or how minor conditions are typically managed. The material may also be relevant to people living in areas where medical facilities are distant or where access to healthcare requires significant travel. In these contexts, printed guides can function as supplementary informational resources rather than replacements for professional care. The Home Doctor belongs to a broader category of household medical reference manuals. These types of books often resemble first aid guides published by health organizations, outdoor survival manuals, or family medical encyclopedias. The primary difference between such guides usually lies in the scope of topics covered, the level of detail and procedures, and the emphasis on specific scenarios such as emergency preparedness or everyday health management. Some manuals focus strictly on first aid techniques, while others include broader educational material about symptoms, medications, and basic health evaluations. The Home Doctor appears to position itself as a comprehensive household medical handbook that combines symptom identification, basic treatment procedures, and preparedness-related topics within a single printed reference.as. With most books in this category, the material is designed to be read independently and consulted whenever the reader encounters a relevant situation. If you want to review the same instructional material discussed in this video, you can find the reference link in the video description below.